So remember, when we're studying, that learning takes time. Learning doesn't take place by sitting down the day before the test and trying to read an entire chapter and figure out what it means. It's important to plan your study and realize that learning is a long-term process. Very few people have what we refer to as photographic memories or eidetic memory. So meaningful repetition is important. And so what we're referring to here with meaningful repetition is that you repeat things intentionally. For example, that you know what you need to study, you know what you need to do with retrieval practice, and you're doing this with a purpose in mind. So when we're learning abstract concepts, most adults have difficulty with this. So we have mnemonics that can help us. Mnemonics are things that, abbreviations, for example, or similar to abbreviations, that will help us remember things. And what's important is that we, the individual, remember them. So the sillier, the better. It doesn't have to make sense to anybody else. It doesn't have to make sense to me. If you can remember something by, for example, a silly song, that's wonderful. If you can remember something by relating it to something silly that maybe a child said that you heard, that's great. Again, it doesn't have to make sense to me. It has to make sense to you. One of the things to demonstrate mnemonics is, what are the colors of the color spectrum? Do you know what that is? Well, there's a mnemonic called Roy G. Biv, and the colors, the letters of the mnemonic give you the colors of the color spectrum. So you have red, orange, yellow, green, blue, indigo, and violet. And that will give, so you can remember, again, I don't know who created Roy G. Biv, or, it's just simply nonsense, but you can remember that and then go back and look at those letters. We use mnemonics in EMS to help remember processes. For example, patient history. So we talk about taking a sample history, and it's not enough just to walk up to a patient and say, what is your sample? Or I'm going to do a sample history. You actually need to go through this. You need to exercise this information. So sample is that mnemonic that helps us remember, well, I need to look at signs and symptoms. I need to look at allergies. I need to look at medications. I need to ask about pertinent past medical history. When was their last oral intake? And events leading up to the event. So those are very important, but the word sample is a mnemonic that you will see often to help you remember what the elements of a patient history are. Flashcards are also very important. There is good science behind writing flashcards by hand. If you're at work or school, or you don't have a way to write things by hand, at sometimes electronic flashcards are okay. But the research shows that the more that we write things down about what we're trying to learn, the better off we will learn those. So it's important you can use 3x5 or 4x6 index cards. Write maybe a name on the front side of something, of a disease process or a condition. And then on the back, maybe write very simply some of the signs and symptoms that you may need to recognize for that condition. You'll want to flip through your flashcards to review them. One of the things that we'll use flashcards for in class is drug cards. When we do pharmacology, we will make flashcards or drug cards out of flashcards. You also want to review your flashcards orally. That's important that, if you're in a place, for example, that you can't speak out loud, that's fine. But in the heart of your study, when you're really studying, you want to be able to review these orally. So actually read through them and say them, not just in your head. So we're going to talk about some memory tips. It's important to focus on what you're trying to study. Again, dealing with distractions, keeping distractions away from you, but really focus your mind on what you're trying to study. Will help you, will help those memories and that learning take place, and moving that information from your sensory memory to your working memory and into your long-term memory. It's important to have a good attitude. Good attitudes go a long way in most of your life, but it is important when you're studying that you have a good attitude. If you don't like studying, or if you don't like what you're doing, if you don't like what you're studying, and having a poor attitude, maybe it's something external, maybe some conflict from the family or something like that, you won't be able to study well. You just won't. So that's important to have a good attitude. You want to be able to classify and associate. So as you're studying, classify things into groups if possible, and associate new concepts with things you already know. I mentioned that earlier. It's important. Adults learn best when we associate something new with something that we've experienced before, or we classify things into groups. There's a reason, when we talk about a 7-digit phone number, there's a reason why those were created, with 3 numbers and then a dash and then 4 numbers. We remember things in groups. And if you've ever tried to write down a phone number, or look at a phone number and try to remember it as just 7 digits, that's difficult. But when you look at 3 digits and 4 digits, then it's much easier. Retrieval practice is vital. Mentioned this before. Again, testing, quizzing, using flashcards. You have to use what you've learned. That builds those permanent ties between different memories around your brain, so that it will move to your long-term memory. Again, association. We remember when we associate things. So we remember about 10% of what we read. And so this is why we don't just do reading alone. We remember 20% of what we hear. So this is why we just don't, rely on speech and hearing. 30% of what we see, 50% of what we hear and see together, 70% of what we say and think about as we are saying it, 90% of what we do and think about is as we are doing it. So if you think about, traditional courses you might have been involved in, let's say the traditional PowerPoint, what we're doing right here, if this were being done in class, you're hearing and seeing things together. So you might remember 50%. Well, it's my hope that you remember a lot more than 50% of what you're going to be doing in class. So a lot of that is, again, you move to 70% if you 70% of what you say, and think about it as you are saying it. So as you are, for example, talking through those flashcards, for example, you want to really think about what you're saying. Again, that's helping to build those connections in your brain. And then the 90% of what we do and think about as we are doing it. Again, excuse me. That's why we do, in the newer way of teaching, we do scenarios. We move from doing isolated skills into doing scenarios and putting those into real life situations, so that you can do those skills and use that knowledge and think about it all at the same time. Excuse me. So studying for the sciences. Knowing how to approach the material is the first step in succeeding. You need to prepare for class. You should always read the chapter and prepare for class before you come in. A lot of the things that we're going to be doing in this class is going to be doing scenarios and discussion and activities about what you've already should have read. So it's important to be prepared for class. So you want to read the material before class. Always attend class and take notes. If you're not taking notes, you're not going to be learning effectively. And also, if you're not attending class, you're not going to be learning effectively either. It's important to find yourself a note buddy. This is someone that you can work with. You can swap notes with someone. So if you do have to miss a class or, excuse me, you're part of a class, you can meet weekly, teach each other other notes, swap notes back and forth. But this is somebody that can quiz you, for example, and you can talk through all these various concepts with them. Again, part of that brain-based learning. Time management is extremely important. You want to study continuously. This doesn't mean study 24 hours a day, 7 days a week. It means don't study one day and then let it go for a week and then try to study it again and try to remember to study again. So study, for an hour or so one day, an hour or so the next day, an hour or so the next day, and then intersperse with retrieval practice and those different activities. It might be helpful to make a study calendar and set deadlines. Some people have to have things written down, so you create you a calendar and when your study time is going to be. Again, you want to make sure that you have time for family and other activities, but make sure that it's helpful sometimes to write that down and to set those deadlines. For test preparation, it's important to condense the material. Again, make flashcards. Write your own test questions and then answer the questions. Make yourself a 10-question quiz, for example, and then go back and answer that. If you have your your note buddy or your study buddy, have them make a quiz. You both make a quiz and then give it to the other, and you try to answer those questions. Use the reading to supplement concepts covered in class. Many times in class, we will discuss things that are not in the book. We'll discuss things that are related to the book. Maybe certain examples, maybe going through case studies, looking at different things that relate to the book. But you're going to need to supplement things sometimes from other sources. Apply the material. As you study, think of applications of the material. So as you are studying, for example, about cardiac problems, think about when you might use that therapy, for example. So if you're going to be assisting a patient with their own nitroglycerin, for example, when are times, when is that going to be given? When are you going to ask the patient, do they have their own nitroglycerin that you can help them take, for example? So thinking through those and applying that material is what creates long-term learning. Use the learning exercises in your textbook, your workbook, or your learning management system. Again, if material is totally brand new to you, I think the workbook is helpful. It does lead you through various learning exercises to be able to do that retrieval practice. Use your formative skill sheets to visualize performing the skill or perform it on a doll or real person. We'll talk about formative and summative skill sheets later. But formative is a learning process. You're learning to do certain skills. And summative type skill sheets are, for example, testing skill sheets. So it's important as you're looking through your formative skill sheets that you actually think about visualizing and performing that skill. So as you're thinking about, for example, taking a blood pressure, actually in your mind visualize, picking up the blood pressure cuff, wrapping it around your patient's arm, that it's in the right position, and you'll learn all this later, but it's in the right position, and then putting your stethoscope in your ears, putting the diaphragm of the stethoscope on the correct place on the arm, and pumping the blood pressure cuff up, and letting the air out slowly to be able to perform that skill. The more you visualize, again, that's retrieval practice. If you're visualizing something, that is retrieval practice. And a lot of professional athletes, for example, visualize. Michael Jordan, for example, talks about when he wasn't on the basketball court, he was thinking about shooting from different places of the court and the things he would have to do to be able to make a basket. So that's very important. Also, if you have children at home, you may have a doll. You may have a real person, a significant other or child, for example, that you can actually practice on. So using the example of blood pressure, get a blood pressure cuff, wrap it around that doll's arm, that bear's arm, wrap it around your spouse's arm or your child's arm, and actually practice taking those. And apply the concepts of the skill sheets as you'll be given them to you. So the next few slides, we're almost to the end here. The next few slides are about some note taking. There are a variety of note taking techniques. It is important that you take notes. However you do it, it's very important that you take notes. So the first method that I show here is called the outline method of note taking. And this method is simply creating an outline. As you hear, like I mentioned earlier, most speakers will speak from an outline. They will cover, for example, as this shows with medical overview from chapter 14, they'll cover the introduction, and they'll cover types of medical emergencies and examples, going down through respiratory, cardiovascular, neurologic, and so on. So as you hear these things, some people work better with this type of outlining method. So it is important to, if that works for you, then that's what you need to do. There's a method called the Cornell method of note taking, and it is basically on the left side of the page. Again, looking at the medical overview, on the left side of the page, you have concepts. So, for example, the first things listed is difference between medical and trauma. Okay. On the right side of the page, you have the answer to that. So what is the difference between medical and trauma? Or whatever the instructor says about the difference between medical and trauma. So again, those things are important. Next down on the list on the left side is what is congestive heart failure? Okay. So again, thinking about those concepts and processes helps cement those memories. Also looking at, the next thing down on the left is many of these conditions can cause pain. It's important to be able to distinguish between them. So, the patient may say, well, I have pain in my belly. Well, there's lots of things that can cause pain in your belly. Another thing about, I mentioned earlier with association to personal experiences. So, for example, if your father had Alzheimer's, for example, or you know somebody that's had Alzheimer's, you've seen what that looks like. So, as you're talking about psychiatric problems or behavioral problems, you've actually seen that. So, think about you might learn more about that condition than you knew before, but think about and relate that to that family member or that friend that had Alzheimer's. Or if you're studying cardiovascular and you have a family member or friend that had a heart attack, and maybe they described to you what that felt like. As you're learning that, think about that and associate those things, and that will help in turning that into long-term memories. And then the last type, this is, again, just 3 different types. There's lots of others. And this actually might be one of my favorites. You take a notebook and with it open, obviously, like it shows here in the picture. And on the left side, as you read your book, you take reading notes. So you're making notes of main points, concepts, and things like that. Then on the right side, you take notes on that same topic from your lecture or from a video, for example. And the instructor is going to fill in things, for example, with medical emergencies and different examples. So as you talk about respiratory things and you're talking about asthma, emphysema, chronic bronchitis, for example, you can relate those to what you've read, and you can also, when you study then after that, you go back and you can see what you read and notes you took, see what the instructor said about those things, and then you can associate those because they're right next to each other, with one on the left page, one on the right page. So that's an easy way to do that. So there is tons of information on YouTube about these note-taking processes and others. So feel free to experiment with these or find others, but search out something that really works for you.